Health Alliance International began working in Mozambique in 1987. A group of U.S. health professionals had come to work in solidarity with the newly independent country in the late 1970s. They were asked by the government to come together and support health care in the country. The AIDS epidemic was just beginning. By the late 1990s, the 16-year-long civil war and economic austerity programs had left Mozambique's healthcare system in tatters. 1.6 million Mozambicans are now infected with HIV. That's 16% of the adult population.
O meu esposo, sempre ele sofria de tuberculose. Naquele tempo não se falava muito do HIV/SIDA. Falava-se, mas era ninguém se interessava em fazer o teste e também não havíamos teste aqui em Moçambique, porque ele morreu foi em 99.
Portanto, o perfil epidemiológico do país mostrava que havia muitas pessoas infectadas, principalmente na região centro. Mas, ao longo do tempo, as pessoas foram ficando cada vez mais doentes e começamos a verificar muitos óbitos.
2001, the cost per treatment per year was around 12,000, 11,000 US dollars, and there were no alternatives for that.
At that time, Mozambique was spending around 1.9 US dollars per capita in pharmaceuticals. This is clearly not enough just to provide the basic care. So under those circumstances, it would be very, very difficult for a country to embark on a large-scale antiretroviral treatment.
Foi difícil, foi ao hospital, tudo não estava a dar certo, tinha que ir andar nos curandeiros, tinha que andar nas profetas. E nesse momento era antes de abrir o hospital dia.
I mean, it just seemed ridiculous 4 years ago when you had treatment that was available for HIV. We knew that the pharmaceutical companies were charging, I think it was 100 times what it costs to sell these things at a profit. And then millions of people, literally 2-3 million people a year were dying, and it was crazy, and it was outrageous. So in the case of HIV, basically a number of people in Seattle started working on churches, or working with churches, working with legislators. We started working with a bunch of different groups to basically raise awareness. And one of the things that a lot of advocacy groups don't do, I think, which is really important, is to raise awareness in the, quote, beneficiary countries or areas.
Rapidly, in 1 year, 1 year and a half, due to pressure, due to more clients accessing these drugs, the Indian companies managed to further reduce the price. And then other partners came on board. We said, no, let us change this and let us open for the public, and let us say that even the public institutions, the National Health Service, can offer the ARVs. So I said, we needed to give the treatment to these people, but alone we cannot afford, let us raise more money. And that is what happened. The whole process was driven from that. And the success of the first experiences was very, very good.
Mas logo quando abri o hospital eu ainda continuava com aquele problema de tosse. Sentia dores aqui no sítio, sempre quando andava assim a inclinar. Eu fui lá, fazia controle de uma semana. O meu controle sempre. Uma semana. Então aquilo parecia que estava a curar mesmo. Dali fiquei mais forte já, por trabalhar, porque às vezes quando você só está em casa, é lá onde você pensa muitas coisas, que a morte mesmo já chegou agora. Mas quando está a trabalhar, você esquece tudo. Aquele problema do SIDA, aquele problema que SIDA mata hoje, você passa na cabeça, esquece. Isso me ajudou muito.
you know, 3 million people are dying every year of AIDS. And so it's like a tsunami. It's like a, you know, a huge international disaster. And in some ways it feels right to just dive in. But then when you step back and look at it, if you're diving in and doing it yourself, you're going to probably do a lot better for your first, you know, 100 cases, maybe 200, maybe even 1,000. And we've seen that here in Mozambique. You know, we see people who treat, you know, who can get 1,000 people in treatment a lot faster than the ministry. But just in Mozambique alone, we have about 200,000 people who need treatment today. And the NGOs are never going to get there. And I think one of the things that we can do is that we can move into the tens of thousands and the hundreds of thousands in systems that are going to be treating 5, 10, 15 years from now.
One thing which characterizes HAI is that they are integrated. HAI, they are not in a district, they are not in a health unit with their own program. They are part of the health unit, they are part of that area of a catchment area, if I might say. So their staff are there together with the Mozambican staff, so they are integrated. The other thing which is extremely important, and here Health Alliance International provided the soldier for the discussions we had about the HIV/AIDS, is to make sure that we respect the country institutions, the country norms. And then HAI was crucial, was one of the organizations which was crucial when it said that some organizations didn't bring the others on board when they were not believing that they could do things in an integrated manner. So that was a major example HAI provided in terms of showing the others who are international as well that no, let us follow one program, which is a country program. Let us be monitored the same way the rest of the people are being monitored, the same evaluation. Don't go to do parallel things. That was crucial.
So throughout the last 2 years, the Ministries of Health's program to expand HIV treatment has been implemented in about 24 day hospitals throughout the country. It started in around the early part of 2003, and day hospitals have been opening subsequently, probably every several months. The goal has been to treat about 8,000 people on antiretrovirals within the first year, and that goal has been reached about a month or so ago. Using this HIV treatment center structure throughout the country, the ministry plans to have a total of 25,000 people in treatment within the next year, and within 5 years about 150,000 people in treatment.
Health Alliance International is working to help ensure that Mozambique's HIV program builds capacity in the entire healthcare system. Even those with HIV need much more than antiretrovirals. After Sophia's health improved, she remarried, but then faced the difficult decision to have a child.
Foi pouco difícil porque eu não queria. Ele insistiu que temos que ter bebê. Foi difícil mesmo. Ficamos pouco separados por causa disso. Mas comecei a ver. Muito se fala que pode-se fazer filho, mas não se contaminar. Eu sei que é risco para mim, é risco para bebê, mas tinha que decidir. Decidir fazer filho. Tinha que aceitar, não tinha outra alternativa, porque eu também amo dele, ele ama a mim. Sozinha sentei, tinha que me decidir assim. Não sei como vai ser o risco de bebê.
Está muito preocupada?
E a preocupação tenho. Tenho mesmo, porque eu sou de uma mãe de risco, então posso passar os riscos para o bebê. Sempre eu penso nisso, se Deus me ouvisse, podia pelo menos sair sã da barriga. O que eu choro é sair sã da barriga. E se sair sã da barriga, eu sei cá fora, vou tentar todos os meus possíveis, posso não comer, para alimentar o bebê.